Well, welcome back, everyone. September is Blood Cancer Awareness Month, reminding us of the impact diseases like leukemia, lymphoma, and myeloma, and it can have on the patients and their families. Now, these cancers affect the blood and bone marrow, but early recognition and treatment can make a difference. So here to share more about blood cancers and what we should know about the disease is Dr. Afonja with the Lima Memorial Cancer Institute. So thanks so much for joining us, Doctor.
Grace, thanks for having me.
Yeah, so can you start by explaining what blood cancers are and also the main types that you often see?
Well, blood cancers are a diverse group of diseases that come under one umbrella. Some of these cancers are genetically transferred from one family member to the other at birth. And when you carry these genes, eventually when these genes, the mutations occur, you find out that some of these diseases manifest in various forms. The different types of blood cancers that we have could be acute leukemias or chronic leukemias. Under acute leukemias, we have acute lymphoblastic leukemia, or you have acute myelogenous leukemia. Under chronic, we have chronic lymphocytic leukemia and chronic myelogenous leukemia. There are some other varieties of diseases like lymphomas and multiple myeloma. With multiple myeloma, it's a disease of the bone marrow where some of the cells called plasma cells in the bone marrow become rapidly dividing cells and eventually lead to diseases by destroying the bone and the bone marrow. So when you have some of these conditions, you find out that the main problem that it produces is the fact that first you might have anemia because your blood cells are not being properly produced because the cancer cells have filled up the bone marrow and they're not allowing all the other cells, especially the precursors of red cells, to grow. You could also have elevated white counts or low white cell counts. Platelet counts can also be affected where your platelets become very low or they are increased in number. There's a variety of presentations. However, these clinical symptoms that you experience mainly is usually mostly generalized weakness, feeling of being unwell. Some people have recurrent infections and probably just upper respiratory tract infection. It might be very mild. You go to the hospital, get tested, and then you do a normal CBC and realize that the CBC results are abnormal. Either you have anemia, low counts, or low white cell count, high white cell count, low platelets, high platelets. Any of these abnormalities could suggest leukemia. And in terms of multiple myeloma, you might have people with bone pains, and with the bone pains, it might be significant in the back, and some people have, in the extreme cases, some people might have recurrent bone fractures, and recurrent infections are also very common because some of these cells, even when they are elevated, some of the white cells are not functioning, and you're prone to recurrent infections by opportunistic organisms. So that's basically, in a nutshell, what we have as far as blood cancers.
Yeah. So are there certain steps to prevent these kind of cancers or catch them early?
Well, if it runs in the family, getting tested regularly, getting checked becomes very important. And when the diagnoses are made, starting treatment early to make sure things do not get out of hand would be the best advice to go with. There are some of these cancers like multiple myeloma that, depending on the age, with chemotherapy, you might need to do stem cell transplant. And the older folks, usually, if they do not get the transplant, we still have very good medications that can keep them going. Multiple myeloma is not curable, even with the transplant. We just have to make sure that we manage this effectively well.
Yeah, so I'm sure that, some people will have questions. And if they do have questions, they can always reach out to Lima Memorial Health System Cancer Institute Medical Oncology. And the number is 419-998-4477. Well, doctor, I really appreciate you coming on today.
Thank you very much, Chris.
All right, well, don't go away because we have more when we return.